Good morning, everyone.
Good morning.
I'm very grateful to be joined by Deborah Carey, our Interim Chief Executive Officer, Dr. Ponni Arunkumar, our Chief Medical Examiner, Dr. Diane Washington, Executive Director of Behavioral Health for Cook County Health, Dr. Joyce Miller, Chairman of Psychiatry, Cook County Health, and Dr. Claudia Fagan, who is our Chief Medical Officer. Got it right this time. Okay. Good morning, and I want to thank all of you for joining me here at Cook County Health. The African American community has borne the brunt of the COVID pandemic, opioid overdose deaths, as well as a surge in homicides. And today we're here to talk about the alarming rate of suicides occurring among our Black residents. There have been more suicides thus far this year in the Black community as in all of 2019. Most notably, we're seeing an increase in suicide among young people. The youngest victim this year was only 9 years old. This is horrifying. It's not surprising that communities that have suffered the most are the ones who also have the least. The disinvestment, the redlining, the systemic racism has culminated in a crisis that once again hits the African American community the hardest. We have no choice but to do better. 2020 is on pace to be the worst year for suicides in the Black community in a decade. The medical examiner's office has already confirmed 58. That's compared to 54 in all of last year. Dr. Arunkumar, Cook County Chief Medical Examiner, will provide more details on what her office is seeing. There's no single explanation for the rising number of suicides, but according to the CDC, anxiety and depression have increased among Black Americans in general amid the COVID-19 pandemic. Dr. Diane Washington, the Executive Director of Behavioral Health for Cook County Health, will discuss the factors, such as the pandemic, homicides, opioids, and poverty, which contribute to an increase in anxiety and depression among Black residents and young people. I'd also like to acknowledge Dr. Joyce Miller, Chairman of Psychiatry at Cook County Health, for being here in support of a very important issue and the work that you do on behalf of our residents. Thank you very much, Dr. Miller. Black communities have been dealing with all the issues poverty creates: violence, poor mental health and physical health, drug use, and suicide. It's time to shine a light and keep conversation going around anxiety and depression in the Black community. We must do our part to raise awareness and get residents to seek the help they need without any stigma and to protect our residents and our young people. I'd now like to invite Dr. Arunkumar to give us greater detail on the deaths we're seeing.
Thank you, President Preckwinkle, for continuing to call attention to the crisis our county faces. And thank you, Dr. Washington and her colleagues, for your diligence in working with some of the county's most underserved residents. Once again, I stand before you as my office reaches another milestone. Today, the Cook County Medical Examiner's Office eclipsed 9,500 cases for the year. In an average year, we handle under 6,300 cases. We have reported more than 4,900 COVID deaths. We're estimating more than 1,300 opioid overdose deaths at this time and close to 550 homicides, and we're only 7 months into the year. These deaths disproportionately and overwhelmingly impact traditionally underserved communities on our south and west sides. And now, as President Preckwinkle said, we must sound the alarm once again, this time for suicides. Last year, at this time, our office had confirmed 218 deaths due to suicide throughout the county, 33 of those in the Black community. This year, we're at 246 deaths due to suicide, and 58 of those decedents were African American. We've already exceeded all of last year's deaths due to suicide in the Black community. We are on pace to double those deaths Most of our increase in suicides this year is due to an increase in the deaths due to suicide among our Black residents. Nearly 80% were men, 40% were under the age of 30. 3 were under 18 years of age. The youngest, a 9-year-old boy, was found hanging from a rope on July 5th. While our office is used to dealing with death, it is impossible to come to terms with the child who felt so hopeless he believed that his only recourse was to take his own life. As I've said many times now, the deaths we deal with in our office are by and large preventable. And that is why I'm here today, because I believe that if we work together, we can in fact prevent many of these deaths. The first step is to identify the scope of the problem, and that is why data from the medical examiner's office is so vital. It is why all the information I've provided to you this morning is available in the medical examiner's case archive on our website. Under President Preckwinkle's leadership, we've done all we can to make as much information as possible available to everyone. Knowledge is power, and we want to empower our partners in healthcare, law enforcement, and our residents to find solutions and prevent more needless deaths. This continues to be an extremely difficult year for our entire community, and it is particularly challenging for our poorest residents and our communities of color. We must do all we can to assist our neighbors who are suffering the most. By the time these residents come to our office, it is too late. I now invite Dr. Diane Washington to discuss factors contributing to the increase in suicide deaths. Thank you.
Thank you, Dr. Arunkumar. I am Dr. Diane Washington, and I am Executive Director of Behavioral Health. Thank you, President Preckwinkle, as well, for gathering this conversation. As a psychiatrist for over 28 years now, I have seen the African American population and the aspects of health disparities related to that. I started my practice on the south side of Chicago in 1994, and I was considered the pillar of health. Just to have a mental health personnel on the south side of Chicago was a huge value to the community. I thought for a moment that I wouldn't have patients, but they came in folds. It was a matter of connecting with the primary care doctors in the community that really served my population. They brought them referrals to me, and we worked together to make sure we took care of those patients. I think that model, that primary care behavioral health model, is something that we need to continue to focus on. So we've been spending a lot of months talking about inequities that exist in our communities. And these are really tough conversations, and these are really complex issues, and they are all multifactorial, okay? So we need to have a conversation about mental health and suicide and look at how some of the solutions that can occur to promote and help save these patients. African Americans are in some of the most vulnerable communities in the Chicagoland area, include the South Side and the West Side. And that hasn't changed for a long period of time. It also includes the health disparities continues to permeate in those communities to this date. So we have to address this issue head on, early, and try to manage it and provide structures to make that happen. So in 2018, the Cook County Department of Public Health did a behavioral risk factor survey, and it showed that 12.4% of Cook County adult residents, varying across age, gender, and race, received mental health care. So that's less than 33% in Illinois of the Black adult population that actually had mental health services. Now, there's some contributing factors that we need to look at, and that's owning the cultural aspects of Black America. There's a lot of stigmas in our own community about mental health. Some of them are keep it in the family, it's a code of silence, don't talk about it. The shame that goes with mental health is huge in our community. Religion plays a huge piece in that. You're gonna go to hell if you commit suicide, and this is the ultimate sin from God, that you commit suicide. These stigmas continue to permeate our community, as well as you are showing that you come from weak stock if you commit suicide. So these are all issues that influence whether African Americans come to get care. There are also some societal stigmas, which include Black people are immune to pain. They don't know how to express emotional pain. And also that this could be seen in a medical condition like sickle cell anemia, where people were in crises and they weren't given pain medications because as a Black society, a Black patient, they can endure that pain. Well, this pain is unbearable, and this despondency and despair is huge. It's overtaken our community, and we need to get serious about managing it. There's overwhelming sense of isolation, despair, hopelessness that occurred during this pandemic that shift the curve to another level. Black youth are not graduating, they're not being educated, they have no structure, they're kind of running amok. And they're getting involved in some very precarious behaviors. And these are as a direct relationship to not having any context of support systems and structure that the school systems do provide, and other athletic outlets that might happen as well. These are self-destructive behaviors that we see, and there are 4 components that I want to really highlight about why suicides are happening. There are 4 components of suicide that you need to be aware of. One, you have to have a means. If that's a gun, if that's a rope to hang yourself, if that's overdosing on drugs. Okay. The other thing is impulse. I'm at my endpoint that I cannot manage anymore. I'm going to take myself out. That is the impulsivity around and the vulnerability attached to it. So it's means, impulse, vulnerability, and fearlessness. I am not afraid to die. And I do think that in our Black communities, a lot of our Black males and youth are saying, I'm not afraid to die. I'd rather take myself out than to have to manage this thing by myself. So there's no simple solutions. The problems are multifactorial, but young males have been plagued by racism, gang violence, drug use, poverty, lack of unemployment, lack of structured housing, and the decomposition primarily of the family structure. They used to have grandma who would pick up the slack and provide some source of stability for them. Grandma is no longer there, or grandma might have succumbed to COVID. So therefore, they don't have that fallback safety net that was once there. Okay? We need to approach this situation in a very systematic way. We need to look at treatable causes and put some resources and navigate coordination of services in order to get that done. And then we need to do preventive measures as well. And that may be tackling the issues of systemic racism as it imparts some of the health disparities that exist in our communities. One thing I know for sure is you can't separate the mind from the body. The mind is the governance of the body. And that being said, if you don't treat the mind, you will not get any good health care gains on the body. So let's treat it as a whole. Let's take a holistic approach to behavioral health and mental health that says these two things work together. And let's put some meat behind that. So Cook County has really tried to come up with some approaches to address this situation. Right now, it's all hands on deck. Cook County cannot do it by themselves. We have to be extensions and provide extensions and develop relationships so we can expand services that are necessary in the community, specifically those communities of color. So everyone has a role to play. And as I stand here today, brothers, mothers, fathers, sisters, aunts, uncles, teachers, pastors, all have a hand in this process. As I said, all hands on deck, and that's what's necessary. One of the things that Cook County has done is to integrate primary care and behavioral health. So we work together with primary care to build this model where primary care can identify behavioral health issues and treat them as well. And we work with them, with our social workers and psychologists, to build that integration and make sure that patient is taken care of. That's a model that needs to permeate across. In addition, we have collaborations with community partners, which is the Behavioral Health Consortium. It's a 12-member agency that is embedded in the community, and the levels of care are based on their geographic zip codes. So we work to make sure the patients are getting care within the communities that they live and can access those services. We also have 2 community triage centers that are used and located on the south side and the south side and the west side. So HRDI is south side, and Bobby Wright Wellness Treatment Center is on the south side. I mean, on the west side. Excuse me. They work together to build immediate care, access to care whenever necessary. And these facilities particularly can be, patients can just walk up into the centers, or they can be dropped off by the police, or they can be dropped off by the fire department or the EMS service, or by a family member who says, this person needs some help. This is a family member of mine, and he needs or she needs some help. So these are those walk-in type of centers that are available for these services. In addition, one of the main social determinants of health that has been totally exposed during this COVID situation is the housing crisis. So for our behavioral health, mental health folks, it's even more extremes. Most of them are living on the streets or in the homeless shelters or in these encampments that you see around the cities. And they are becoming more and more disgruntled with lack of care, with lack of medications. They're oftenly psychotic, and they're oftenly not getting any treatment or services. We need to manage that very, very vulnerable population. We need to build housing to support their life, and we also need to understand what housing does. Housing builds one's wholeness, the wholeness, and it gives you a sense of a self-esteem, that you have a place to come and lay your head. These are human things that we need to really look at. And we have our housing director, Christine Haley for Cook County, who's been working very diligently to connect those dots and to provide assistance for some of these patients who have behavioral health needs. Again, there's a lot of work to be done, and I can tell you we're just beginning. This pandemic and beyond has exposed a huge amount of gaps that we need to fill. I am encouraged to continue to work on this process and to make it better. Thank you.
Thank you very much, Dr. Arunkumar and Dr. Washington. All right, questions? Karen? Nick?
Rachel? Questions? Alice from the Trib, any questions?
Hi.
Yeah.
I'm wondering what geographic areas are most affected by suicides within the Black community.
All right, Dr. Arunkumar, do we have any particulars on the south and west side of the communities that have been most impacted?
Other than south and west side, I don't have any details, but we can get some information to you on that.
Thank you.
Thanks.
And I have one follow-up, if that's okay.
Yes.
When can you first notice the rise in suicides this year? Like, was it before or during the pandemic?
Okay, Dr. Arunkumar?
Again, I don't exactly know when we started seeing an increase, but we do see the increase over the last 7 months. Again, we can get those details as to when these incidences were occurring to you.
Thank you.
Okay, so we'll provide you with information on when we saw an uptick in the suicides and particular communities that have been most impacted.
Anything else, Alice?
No, that's it. Thank you.
Lakedra?
Yes, I had a question regarding something that Dr. Washington had mentioned, which is that stigma does play a part, especially for Black communities. But when I spoke to mental health professionals about, the need that they are seeing right now, they say that access is really the bigger issue, that people in these very vulnerable communities do not have access to care. So I was wondering what health officials are doing to spread awareness so people know where they can get service and where they can get access in the sort of immediate short-term timeline.
Yes, the access issue has been problematic, and it is also a situation where technologies are not available in the Black communities, specifically these disparate communities. So during the COVID, we did a lot of telehealth, telemedicine. And one of the things we found out was that a lot of people didn't have the ability to receive these services by telehealth. When they added the fact that you could do telephone, that really helped tremendously in terms of providing access. So we were able to call versus the Zoom or Skype or FaceTime kind of a situation. So that has helped as well. Access plays a huge issue culturally, so I understand that the services are there, but if the patients aren't willing to come, then you're not making any gains. One of the things that I thought would be very helpful was to put some resource behind patient navigators or community health workers who could go into the community and help navigate patient care. Sometimes just having that helping hand does a huge amount of service. Mental health and behavioral health have negative connotations in our society, so we might need to reframe what that means or what the name should be. I think of compassionate care would be a lot more uptake. A compassionate care worker or a compassionate care navigator to help connect the linkages of care and services and yield and get you out to those services or get you connected to those services. That would help a tremendous amount.
Lakedra, anything else?
Yes, I was wondering, are the community health workers going into the community, is that something that's happening right now for outreach?
Some of our behavioral health consortium members have done some of that work, but it's not across the board. It's not consistent. But this type of approach should be more of a systematic approach and consistent across every element of behavioral health care in the communities, as well as internally within our own institution here. So I do think there's a need for more resources devoted towards those community health workers.
Thank you. And will that happen this year?
Well, for our, like I said, from our behavioral health consortium members, it is happening currently. We just need more of it. Again, it's multifactorial. We have to have a broader catch, a safety net for these folks.
Okay, thank you. And my last question is, does the county have a suicide prevention plan in place currently?
The county is working on a plan currently of a suicide prevention model. We are building it as we speak, and we are responding to the current data and needs that are presented before us. So yes, we are in the process of building that prevention system.
All right. Are there any other reporters on the line that haven't asked a question yet?
This is Rachel Hinton with the Sun-Times.
Yeah, Rachel.
Hi. I wanted to know when that suicide prevention plan will be completed, or, a timeline for that.
We are working on implementing some of that plan in stages, but we are starting, probably within the next couple of weeks, we'll be able to do more around that work. We need to be able to connect the resources. It's not so good to just start a plan without making sure you have identified the resources and the relationship developments and connections that are necessary in order to completely eradicate suicide. So this is a national problem, and it takes a huge effort and connection with our community partners as well. So we're in the process of laying that structure down at this time. So hopefully before the end of the year, we will have a comprehensive program in place.
How much might this plan cost, and what does the plan currently entail?
Again, that's some of the things we're looking at right now. As we start to engage other community partners, as we start to provide more prevention and awareness, these resources are being looked at in terms of the amounts of dollars that would be necessary in order to build that structure. So we are currently looking at this at this time.
All right.
After this spike was first noticed, were additional resources rolled out, or was there, any sort of awareness campaign for those resources in communities where you've seen spikes?
I missed the question.
Rachel, can you repeat?
After this, Sure. After this spike in suicides was first noticed, were there additional resources rolled out by the county? Was there any awareness campaign for those resources, especially in communities where you are seeing a surge in suicide?
So one of the things that we have at least started to do was educate our providers around, and I mean all providers, whether they're clinical or non-clinical, around the aspect of suicide. So we've all been currently working through a learning module system that we have in LMS, that we're educating all of our staffs around key components of suicide and what that looks like and how to manage it. So I think we have to educate first all of the providers so that they can spot suicidal ideations or issues around that suicide so that they can intervene immediately. So education first, and that's what we're rolling out first, is the education component.
Thank you.